Thank you, Councilmember Graham, and good morning, Councilmember Wells, Councilmember Che, and other staff. My name is Marta Beresin. I'm an attorney at the Washington Legal Clinic for the Homeless, where for the past 14 years I've worked directly with homeless families in the District of Columbia. My testimony will address the current challenges facing DHS with regard to homeless families, as well as how we can change course to stop the trend of increasing family homelessness in D.C. We have a crisis in family homelessness largely for one reason, as Councilmember Wells pointed out, because we failed as a city to adequately preserve and produce affordable housing. Instead, we've allowed neighborhood gentrification to occur with little regard to who was displaced or how many affordable units were lost. In the last decade, we've lost half of our affordable housing units in the District of Columbia, and we've largely ignored the Comprehensive Housing Strategy Task Force recommendations of 2006, which recommended creation of almost 70,000 affordable units, including 14,000 local rent supplement vouchers for extremely low-income renter households. We've only created, in the last 8 years since the plan was passed, 2,343 vouchers instead of the 8,000 called for under the plan. As a result of these losses, not only are families becoming homeless at higher rates, but they're also staying homeless longer, because we're creating a logjam in the shelter system, and that's causing some of the numbers that we're seeing today at DC General, in motels, and now beginning in the rec centers. Family homelessness increased, as you know, from 73% from 2008 when the recession began to 2012, and I believe it will continue to rise in coming years unless the DC government focuses more on preservation and increasing production levels. In addition to the continued loss of affordable housing, other factors may be playing a part in DC's immediate current crisis. DC should study the effect that 3 recent and significant policy changes are having on the rate at which families are becoming homeless and their ability to reconnect quickly with housing. First, what effect is closing the front door to shelter 7 months of the year having on shelter application rates during the winter? Beginning in the spring of 2011, the city withdrew a long-standing commitment it had made to ensure that no family with a minor child was forced to stay on the street no matter what time of year it was, defaulting to the letter of the law and admitting Priority 1 families to shelter only when the weather was forecasted to be hypothermic. As a result of the pent-up demand from spring, summer, and fall, each November we're seeing higher and higher numbers of Priority 1 families coming into the resource center, and they may be coming in with higher needs due to weeks or months of staying in unsafe, unhealthy, and unstable settings. How is this affecting DHS's ability to assist these families? Are they taking longer to exit shelter and thereby contributing to the logjam? Second, what effect is focusing an increasing amount of our resources on short-term rental subsidies having on family homelessness rates and length of stay in shelter? We know that some families are cycling back into homelessness after stints in short-term housing programs. In addition, some families and landlords have been reluctant to enter into lease agreements when there's only a guarantee of 4 months of assistance under the Rapid Rehousing Program. DHS's rate of transitioning families from shelter to housing this winter, while starting to improve, is not as high as they had hoped for, contributing to a backdoor exit problem that's clearly contributing to the higher numbers of families in shelter. Third, what effect has implementation of TANF time limits and flat benefit levels amidst rising housing costs had on family homelessness? Many TANF recipients struggle to afford housing, as most do not receive any housing assistance. 6,000 families who currently receive TANF are currently homeless or doubled up with other families. As a result of TANF time limit cuts and flat benefit levels, more and more low-income families who rely on TANF during bouts of unemployment may be forced into shelter because they cannot survive otherwise, even doubled up with other families. If you believe, as I do, that homelessness is not caused by bad personal choices, flawed character, or a culture of dependency, but by poverty, lack of affordable housing, unemployment, and suppressed wages, then the D.C. government must take a look at these policies if we want to reverse the tragedy that increasing family homelessness and poverty visit upon a third of D.C. children. And I have 3 recommendations for the immediate short term and 3 for the long term. D.C. needs to bring all of its cross-agency resources to bear to find an alternative to sheltering families communally in rec centers. The Homeless Services Reform Act requires that families be sheltered in apartment-style shelter units or in private rooms when no apartment-style shelter units are available. The law requires this for the safety, health, and stability of homeless children. Most families have left the rec centers after staying 1 or 2 nights. This means that while they felt unsafe staying in their cars at Union Station with abusers or in ER rooms, they felt less safe sharing space with strangers in D.C. rec centers. Some alternatives D.C. should explore immediately are the Spring Road building in Ward 4, other vacant D.C.-owned properties, vacant public housing units, expanding to an additional floor at D.C. General if available, or Capitol Hill Group Ministries Congregational Based Shelter Program, which was in existence last year but not this year. The legal clinic fully supports the plan that was devised by a working group of the Strategic Planning Committee of the ICH to increase the speed with which families move into rapid rehousing units and fully resource that program. In addition to the suggestions outlined by the working group, DHS should work with DCHA, DHCD, and the myriad of other DC agencies that work with landlords to immediately reach out to all such landlords for available units for rapid rehousing. DHS should be provided with adequate resources to address the current crisis without cutting other critical services, such as services for singles, during and outside of hypothermia season. Finally, as far as long-term recommendations are concerned, in order to renew its commitment to comprehensive affordable housing strategy, DC should invest in 1,000 new local rent supplement vouchers in fiscal year 2015, some of which should be used for permanent supportive housing for families. We commend the Mayor for his recent investments in the Housing Production Trust Fund and support DC's emphasis on building new affordable units, but production takes time and vouchers will create affordable units immediately. Second, DC should return to its policy of ensuring Priority 1 families have access to emergency shelter, ERAP, rapid rehousing, and other emergency solutions year-round. It's both a moral imperative and wise fiscal choice for the city to ensure that no matter what time of year it is, no child sleeps in an unsafe place. Serving Priority 1 families when their needs arise increases the chances that the government can quickly reconnect them to stable housing before long-term homelessness leaves them with greater obstacles. Finally, DC should consider increasing TANF benefits to bring them in line with Maryland's benefit level and enable families who rely on them intermittently to maintain their housing. Finally, DC cannot simply continue business as usual or will continue to dig ourselves into a deeper and deeper family homelessness hole. We look forward to working with the Council and the Administration to resolve this crisis and firmly believe that with the right policy choices and investments, we can resolve it, as well as find ourselves in a very different position.